A sign outside Eduardo Teodoro's hospital suite suggests the worst is over. But more than 2 months after contracting COVID-19, he's still in this Scarborough ICU. A place of hope and loss, reflecting the missteps and disparities beyond its four walls. Eduardo's wife Esther is one of the rare few outsiders allowed to visit, because she too was infected in January and recovered, while her husband's condition kept getting worse.
Ed, are you in pain? Huh? Ed?
A breathing tube means Eduardo can't answer her. All Esther can do now is quietly share his pain.
He's a good husband and he's a good father to my kids. It's not easy for my family.
If 75-year-old Eduardo survives this illness, his recovery could last for years. A new challenge for the couple who've been married for close to 4 decades after first meeting in the Philippines.
He was a nice guy. Yeah, he was a very nice guy. He fall in love with me, but still he loves my family, you know. Yeah, you'll be okay.
In this catastrophic third wave, their experience is now all too common. Today, this ICU wing is busy, but eerily quiet. Even this empty room where a patient recently passed away won't stay out of use for long.
So far in Wave 3, we've admitted 7 husband and wife couples. And I think it's a sign that the virus is getting into homes, affecting everybody, and because it's so much more powerful than the prior virus we're dealing with, more people from within that household are coming to hospital together. Everything looks okay for now, but those are lungs that are not going to get better anytime soon.
Medical Director of Critical Care Dr. Martin Betts leads this ICU team, which has faced high rates of COVID-19 admissions for months. One recent night is lodged in his memory.
I put 8 patients on mechanical ventilators overnight, and the hardest part of all of it was the conversations in those moments before you had to do so and seeing them say goodbye, because we know that they're going to be on a ventilator for some weeks in a medically induced coma, so we can provide effective ventilation. And we know probably half of them aren't going to survive.
Many of those falling ill here are essential workers, often people of color, and now younger than before.
This is very, very different.
Lorraine Pinto has been here for 23 years, helping extended families navigate their loved one's critical illness, but never quite like this.
Imagine someone, just like you and me, who were functioning fairly well, may have gone to a job in a factory, contracted COVID, we may be in their 40s or 50s, and their whole world is upside down.
Today, registered nurse Jose Pasion is wearing extra layers of PPE as he cares for a man in his 50s in an isolation room, while the team awaits the results of the patient's COVID-19 test.
We're seeing all walks of life now, the ages are actually coming even to the younger generation. So we're seeing even 20s, 30s. First, we didn't see that before.
So this patient, because of the duration that he suffered from his COVID illness.
Pasion and Betts often work side by side, and they're feeling the toll of caring for more and more patients in the prime of their lives.
The physical work we can get by, and we can be here, and we'll be here for our patients whenever. It's the emotional toll of seeing what they're going through and knowing what their families are going through that really weighs on us.
A 10-minute drive away at another busy hospital site in Scarborough, the gatekeepers of the emergency department say the level of illness and pain is reaching new heights.
Never seen anything like it. In fact, it's the worst we've seen since the pandemic started.
Dr. Norm Chu has been chief of emergency medicine here for close to a decade. Right now, he says roughly a quarter of all COVID-19 tests taken here are coming back positive.
Particularly in Scarborough, we've been disproportionately affected by COVID, a lot of multi-generational families, lots of factory workers, lots of essential workers.
The threat of the virus is on everyone's minds, as are the consequences. As Paula Clark spends her day cleaning patient rooms, wiping every surface with a towel soaked in bleach, memories of her late mother come to mind.
My mom died with COVID, so I have to make sure everything done properly.
So I'll wipe this down.
It's a burden Clark carries while trying to keep others safe.
I go to the back.
But with bills to pay, she shows up, shift after tiring shift.
It's hard because I didn't get to see her. So, you know. Yeah, I saw her this Sunday on the video and then she died in the evening.
As new patients keep on coming, Dr. Chu says many members of his team are close to hitting a wall and burning out.
Most of us work in the emergency department because we like the adrenaline, we like the fast-paced work. But now after a year, it's quite draining and we're almost at our limit.
From the emergency department back to the ICU, Dr. Betts wonders why the tragedy of the third wave wasn't prevented.
You know, if you go back to early February, I think the modeling data for these new variants was quite clear what could potentially happen, and unfortunately it's been realized.
Eventually, this pandemic will end, but few people here will be left untouched. Staff haunted by loss. Young lives forever changed.
I love you, Ed.
And families bonded by love and by a virus torn apart.
I love you.
So, Lauren, there's some really wrenching moments in there, and I suppose the first thing first, how is Ed?
Well, we caught up with the ICU staff, and Ed is still on a ventilator today. But his family remains hopeful that he'll be going home soon to see his wife Esther and their kids and their grandkids.
So in watching it, what I find sort of both interesting and worrying is that when we went into the ICU a few months ago, the anxiety then was that patients were younger, they were staying in the unit for longer, struggling for longer, and I'm wondering, how is that playing out now?
Well, in Ontario, part of the challenge is we started this wave with so many of those patients still from the second wave and even a handful from the first wave. So now we're sort of playing catch up here and dealing with all of these new challenges. What we heard from the ICU staff is that the patients entering the hospital today could still be there in June or July or even longer. So it's a tough road ahead. Adrienne?
Okay, that is a worry. Lauren Pelly tonight. Thank you, Lauren.